At March of Dimes, their mission is to improve the health of babies by preventing birth defects, premature birth, and infant mortality. To achieve this, they fund medical research, community services, health, education, and advocacy. This year, they will invest $2 million in Colorado programs alone to help our state's moms and babies be healthy. Through their community services, they help thousands of Colorado moms, babies, and families. Their health education messages reach hundreds of thousands of Coloradans, both members of the general public and health professionals. And their medical research helps moms and babies everywhere. Fighting premature birth, or when a baby is born too soon by 3 or more weeks, is a primary objective of the March of Dimes. 1 in 8 Colorado babies is born prematurely, placing them at a greater risk for immediate and lifelong health struggles and newborn death. Through all of their programs, they seek to understand and to solve this problem, which has grown over time to be the biggest threat to a baby's health. It is the leading cause of newborn death. Approximately 71,000 babies are born annually in Colorado. 65,000 of these babies are born full-term and healthy. Yet, 1 in 8 Colorado babies is born preterm. Sometimes good choices are not enough to prevent babies being born too soon. The March of Dimes is fighting to unravel the mysteries that cause these problems. In an average week, 165 Colorado babies are born preterm. Preterm birth is the leading killer of America's newborns. In a year, approximately 450 Colorado infants die before their first birthday. 74% of those deaths occur in the first 27 days of life. Or, each year, approximately 333 Colorado babies die during their first month of life. Those that survive may be blind, mentally retarded, have cerebral palsy, or developmental problems. Babies born preterm were more than twice as likely to have major birth defects as full-term infants. Premature babies may be small, but the struggles that they face are not.
Hi, I'm Monty Haltian with Crossroads Wine and Spirits. We're at the March of Dimes Signature Chefs event. It's one of our favorite events to do of the year. Great charity to give to. We provide the wine, the drinks, the libations. We make the people have fun, and they bid, and they give, and they give. And it's a great event to do, and we love the March of Dimes. If you didn't come this year, you should check it out next year. 100% fun.
According to the 2009 March of Dimes Colorado Mission in Action, $1.85 million in research was allocated to find answers to factors that adversely impact pregnancy, infections, genetics, diabetes, hypertension, etc. $123,000 in services were paid to ensure that women know about risks to their unborn infants, that they receive appropriate prenatal care, and have support during their pregnancies. $31,000 went to advocate for improved access to care for women, infants, and children to ensure screening for birth defects and services for babies born with disabilities. $68,000 went for support and services to families dealing with the crisis of having an infant in the neonatal intensive care unit, born too soon, too sick, or both. $75,000 went for educational programs for healthcare providers and our community neighbors. Plus, at March of Dimes, they advocate to policymakers, provide health education to public and professionals, and help families with critically ill babies cope. Of every dollar raised by the March of Dimes in Colorado, 87 cents furthers their mission.
So, 800 hours of year number 518.
The Signature Chefs Auction takes place in 4 sites across the state of Colorado. It is an event showcasing the local chefs while the guests enjoy wine and entertainment and silent and live auctions. In Grand Junction alone, the event is held in a unique venue, an airplane hangar at the Grand Junction Regional Airport. Across the state this year, the Signature Chefs Auction events will raise $450,000. Thank you for your support of the March of Dimes.